For today's video, I'm going to be giving you guys the breaking news within Monrovia, Liberia, and Liberia as a whole. Today, there was a report and it has been confirmed, and even today, the president of our country, he addressed the nation, telling us what we need to do. Coronavirus is now in Liberia, guys. So this is becoming very, very alarming. That's why I decided to come out to make this video, because I did a video on this coronavirus when it just started coming up, but now it is like affecting us. One of the ministers is not like a minister, but he's working at the Environmental Protection Agency. He's the head. He came. His name is Nathaniel and Blamo. He came to Liberia on Friday, and he came from Swaziland. And when he came, he wasn't tested, and now after he was tested, it was confirmed that he had the virus, and now it's very alarming. So I'm doing this video so that I can be able to educate my people on some of these measures that we need to take seriously. This is not for a joke. This is very serious, guys. We always need to wash our hands. Wash your hands like 5 minutes. You should wash your hands every 5 minutes, every time. You should wash your hands as often as possible. You should also have your sanitizer with you. You should stay away from public gathering, guys. And you should please inform other people. Make them to know that this thing is serious. It's not a joke. Ebola came into Liberia and we suffer a lot. So we shouldn't allow history to be repeated like the death that came out about doing Ebola time. It shouldn't happen this time. We should try to take this thing seriously. If you are feeling cold, some of the symptoms of this virus is coughing, sneezing, feverish feeling like that. So if you feel of these symptoms, you should just go to the nearest hospital so you can be tested. Educate your friends. In the lay library, we can say tell everybody they think not one person business, that everybody business, because we have to join hands in kicking this thing out of our beautiful country. So I just decided to make this video.
The virus spreads when people cough or sneeze, and tiny droplets containing the virus are released. These droplets can land on another person's mouth, nose, or eyes, and that allows the virus to enter a new person. When a person with COVID-19 travels to a non-affected area, this is called an imported case. If they start spreading the disease to household contacts and those around them, it's called local transmission, since it's usually isolated to a small area and can be easily traced back to the original person. However, when people begin to contract the disease without a clear source, it's called community transmission. To prevent or contain community transmission, some schools and businesses have shut down, and some conferences, sporting events, and other large gatherings have been postponed or canceled. Once a person is infected, symptoms develop about 5 days later. This is called the incubation period. And anyone with mild symptoms, regardless of whether they have been diagnosed as having COVID-19 or not, should wear a mask, and they should self-quarantine within their home. If those symptoms worsen, they should call their clinic. For people with symptoms that live with others, or even with pets, they should self-quarantine in a separate room, and use a separate bathroom if possible. And they should avoid sharing household items like bedding or eating utensils. In fact, there has been a confirmed case of human-to-dog transmission, where COVID-19 went from a person to their pet dog. However, the dog didn't get sick, and there's no evidence that pets can spread this disease or become sick. So it's not necessary to take measures against companion animals. Finally, anyone with symptoms, including children and younger adults, should not attend school, work, or any other in-person gathering, and should avoid travel. Now, for individuals that don't have symptoms but are at higher risk, like those over age 60 and people with a chronic disease, the recommendation is that they also self-quarantine to avoid the chance of getting sick. Self-quarantining requires keeping a few weeks' supply of your medications, groceries, and household items, as well as having an emergency contact person. Coronaviruses don't usually spread over long distances in the air, but they can get flung from one person to another on tiny droplets of saliva when someone's coughing or sneezing. In addition, some strains of coronavirus can survive on surfaces for over a day. With that in mind, if you're a healthy person living in a non-outbreak area, the recommendation is to avoid travel to disease outbreak areas, generally stay away from crowded places, and stay at least 6 feet or 2 meters away from anyone with symptoms. Wearing a surgical mask is not recommended because they're meant to catch droplets from a cough or sneeze going out, rather than preventing you from breathing in the virus. Similarly, wearing an N95 mask is not recommended because they're only meant to be worn by healthcare workers. In addition, cleaning and sterilizing frequently touched surfaces like toilet seats, door handles, phones, and keyboards is also a good idea. As always, careful hand washing is key, and it should be done with soap or alcohol-based hand sanitizers and scrubbing for 20 seconds. Also, avoid touching your eyes, nose, and mouth. This is the area known as your T-zone. It's a common entry point for viruses into the body.
And officials from the Ministry of Science and Technology have said clinical trials show a conventional anti-malarial drug is effective in treating coronavirus patients.
I was on social media yesterday, just checked out Twitter in the evening. Imagine it had even been trending since morning. And I just saw chloroquine as cure for coronavirus. I thought it was a joke. And one thing Twitter has taught me is Google first before you make any statement. And then I Googled it, saw some Chinese websites, they translate. I even went as far as looking for a particular Chinese website I know for their news, that you just click on translate on Google Chrome. Same thing. And I was like, what was that stuff they said? The rejected stone.
But there has to be a more thorough breakdown of the reasons why it's considered one of the three.
Yes,
right?
one of the three. Yes, there are 3 of them.
Things that could be a cure for coronavirus.
Professor of Epidemiology at the University of Health and Allied Sciences, Fred Binka, says a current report suggests that the popular drug for the cure of malaria, chloroquine, has been certified as having the capabilities to cure coronavirus. The former Vice Chancellor of the University of Health and Allied Sciences revealed this while sharing his thoughts of a possible treatment plan for this novel virus last Saturday on Key Points.
In another 2 weeks, there will be a lot of drugs that will come online. People are doing the test. They need about a month to 6 weeks to be able to do the test. I read about a new finding which made me a bit happy. They found that chloroquine in China has been now certified. Chloroquine, our famous chloroquine,
which we sidelined at
has been found to be able to treat this virus.